Okay, hey everybody, Sally here from Switch on Health. So this is the next instalment that I'm doing for remedies, and today I'm going to do Pulsatilla. It is a remedy that is one of the polycrests. It's one of the major children and female remedies, and you will find that you will use this often in clinic, both acutely and constitutionally or chronically. So let's delve into Pulsatilla. So this is what it looks like. Very pretty little purple flower. So you might find that your patients may even wear the colour purple, or they may, in fact, come in florally type clothes. All right, but we'll talk about that in a little bit more detail as to appearance a little later on. So, also known as the pasque flower or the wind flower. And it's this delicate little flower that sways, so you can imagine it changes direction, it turns around, so it just sways gently in the wind. As I said, predominant, well-known female children's remedy. But the appearance that you may often see for Pulsatilla is that they are blonde, blue-eyed. Little children, the little girls in particular, wear these pretty little girly dresses, and you will find if you are doing a consult on the child, they tend to be the ones that might be a little bit timid, a little bit shy. They cling to mama because it's like, oh, this is all very new and I'm not quite sure about this. And you may find that they have very porcelain-like skin, very white, but they may also look quite pale. So this is a little bit different to, say, something like belladonna, where you will see red-faced. So appearance also. So when your patient walks into the clinic, into your practice, you will look at them and you will go, okay, I can rule out this, this, and this potentially. But until you take the case, a full case, you will not always know. Okay, so it's as much about physical symptoms as it is about mental and emotional symptoms, very much about mental and emotional symptoms, and we'll discuss that now. There are some strange, rare and peculiars. A great one is a sensation as if cold water were being poured down their back. So you might find that they're shivering a lot, the expression of someone's walked over my grave when someone shivers, or, there's that sensation that there's cold water running down their back. A sensation as if they're beside themselves. So they may feel that they're having an out-of-body experience, that they're looking at themselves next to themselves. So it's just this weird, strange sensation that they are beside themselves. And then the sensation as if they're dancing. So there's that beautiful little swaying pulsatilla in the wind. So they feel like they're swaying. They may not physically be swaying, don't get me wrong, but they feel like there's that sway motion about them. And one of their great dreams is they will dream of cats in particular. And it could be any sort of cat. It could be a domestic cat or a wild cat. So here are some of the mental and emotionals. Losing of oneself due to lack of beliefs and opinions. So these people are one or the other. So one of the biggest key symptoms for Pulsatilla is that they have changing symptoms. So they may not have very good beliefs, or they may be very, very opinionated and very belief structured. And we'll talk about that as well. So codependency, they jump from relationship to relationship because one of their greatest things is about being loved. They want to be loved. They want to be in love. It's all about love, 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 love. So hence the reason why they will jump from relationship to relationship, but also because they do not like to be alone. They do not wish to be alone, so they will always want to have company. They do not like it. It is one of their greater keynote symptoms, and you will find that is one of the reasons why they jump from relationship to relationship. So as soon as one is finished, they'll jump into a new one. And it's certainly not a rebound type thing. It's like, I do not want to be alone. This particular patient is very teary. They will often weep while telling their case, right? They're not hysterical. They're not, they're more. So you need to listen for that little hitch sometimes in their voice, because they may not necessarily want to cry in front of you, but they often will cry when they're talking about their symptoms. And listen out for that little hitch, that little, because that's when you're closest sometimes to their causation. Okay, so in this situation, tearful, soft weeping. They want sympathy. This is one of the keys. Another key to Pulsatilla is they crave sympathy. They want to have someone to go, there, it's going to be okay. You're okay. We're all okay. There. Especially when they're talking about their issues. So there is that sort of classic, and it's, victim mentality. Not a martyr as such, but more, I'm sad, I'm alone, I'm going to cry because, no one loves me. All right. So, in saying that, as you can see there, abandonment, bold, 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 bold. That feeling of being unloved and forsaken. But be aware also that you could also look at that with magnesium carbonate as well, because mag carb also has that no one loves me type feeling as well. So differentially diagnose with that sort of situation too. Fears, you can see there, again, alone, abandonment. Key words. You'll hear them say it. I don't want to be alone. I feel like I've been abandoned. They're not the sort of I've been betrayed type, but I've been abandoned. So, it's all woe is me and I am sad. There is the heights. They don't like the dark. They don't like ghosts. So these are sometimes for little children who may experience nightmares, but who sleep with a nightlight on, or have watched some cartoons that may have ghosts in it. They're that sort of pulsatillary type state. In the dark, they don't like it, so they may get up at night and come and sleep with mum and dad. That could be a pulsatillary type thing as well. The pulsatilla does not like crowds. They are claustrophobic. They do not like small spaces. Okay, so they're two other things that they will say. And these are questions that you can ask. How do you feel when you're out and about? A big thing with pulsatilla, though, is that they crave open air or being in cool air, and we'll talk about that. So, in the positive, these people are soft, they're gentle, they're kind, they're loving, they're sweet, they're affectionate, and they're very feminine. So the little girls are very little girly, the women are very feminine, and they are often people love them. People really like them. Okay. They're the nurturers. They have a very big mothering instinct, unlike sepia, who wants to be detached. They are happy to have their family in a different room or even in a different country, maybe sometimes. But sepia, different to sepia in that regard. And sepia and pulsatilla are two very big female remedies. So that's one way to differentiate them, whether they really want to be in with company, in with their family, love their family, talk about their family, or whether they say, yeah, I can take or leave my family, and I don't care if they're in another room or another country or whatever. They're not quite that distant, they're more detached, the sepia. Negative, though. Now, negatively, there are major mood swings. So they can be happy one minute and, not so happy the next, irritable, sad. So you can start imagining sort of some of the mental health situations you could consider for pulsatilla. Now, they appear timid. They like to share their feelings, so they're very much the type of woman that talks about their emotions a lot, and therefore their husband may switch off because they do like to share their emotions, their feelings. The child wants to be carried. Now, a little different to the chamomilla child. Yes, they want to be carried also, but the chamomilla child may also want to be dropped and not, chamomilla is a little bit, yes, I want this, but I don't really want this. The adult Pulsatilla will love hugs. They love giving hugs. They love receiving hugs. They're gimme, 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 gimme. And you will find that they tend to be very good huggers as well. They're quite childlike in their manner. So they might be, and we'll talk about this, a little bit mischievous, but they are very submissive. So it's yes sir, no sir, 3 bags full. Okay. They just go along with everybody. So they're the type of person in a group of friends, when everybody says, what movie do you want to go to? They'll say, I don't mind, let's go wherever, even though they don't want to see that scary horror movie. Okay, so they're quite yielding. They are agreeable. They're a bit too agreeable, really. They're that people pleaser. They don't know how to say, because they believe, and this is very big here, and a lot of you will think this, because a lot of you being mothers, they do not like to say no because they believe that they will not be loved anymore, or that they will not have friends anymore. So boundaries can sometimes be a very big thing here for Pulsatilla. Like I said, believing them to be kind. Everybody thinks that they're kind, they're agreeable, they're yielding. But that's twofold. Here's this changing symptom stuff. They are manipulative. The children are highly intelligent and know how to get their way. They are attention seeking. They can manipulate a situation. If they want something, they will get it. They want sympathy. They want reassurance. If they want it, they will get it. So again, here's this twofold where they have no beliefs, but then they can flip and have many beliefs. They're fixed with their beliefs. That could be religious or political. It can be fixed as to the people that they choose in their lives. It can be fixed as to the ideas they get in their head. And there's no changing. They're very dogmatic in that regard. There's no change. Now, the men, don't get me wrong, just because I said this is predominantly children's and women's, I do give this to men. I give this to men that may appear quite feminine, that men that also can be very attached to their family. I will sometimes give this with Ignatia, because there's grief and loss, for men who will talk about their family often, and now they're divorced, and there's court cases going on about custody and all sorts of things. Yeah. And especially if they talk about it where they're being quite gentle, not angry like a nux, or ragey like a stramonium. It's more that gentle, yielding, easygoing. Yeah, look, I just really want to see my kids. But the custody that I'm going through has not allowed me, but it's just the way it is. Okay. So that's your mental and emotions. Let's move on. And these are some of the generals. So the first causative aspect about pulsatilla is they are never well since puberty. So that is their first symptoms may actually happen on their first menstrual cycle, or when they first start to get boobs, or when they first start to notice that they've got hair in their pubic region or under their arms. Their symptoms may start then. That's when they may get sore throats. That's when they may get headaches. That's when they may get allergies, etc. So never well since puberty. On the other side to that is for women that get pregnant, and this is also a sepia aspect, never well since pregnancy. Now, you need to be careful with pulsatilla and prescribing. Both pulsatilla and sepia really should not be prescribed whilst the patient is bleeding. They are prescribed outside of the bleeding cycle because it can cause aggravations. And during pregnancy, you would not give it because it can actually bring labour on. So be careful. That's a real sort of cautionary tale with both Pulsatilla and sepia. I know that you've probably read in all the Materia Medicas, it's all about sepia and Pulsatilla for menstrual cycles and PMS and rah, rah, rah. But during a bleed or whilst pregnant, be careful. Put it this way, I don't prescribe any remedies in that first trimester unless it's something like a tissue salt that's not going to cause too much grief. Yeah. Moving on from there, this is another thirstless remedy, but they are also hungry, not knowing what they want to eat. They'll go, oh yeah, well, what am I going to eat tonight? I'm really, really hungry, but I don't know. Discharges. Now, discharges here. These, when we talk about generals, these are all the sorts of things that individualize a patient. So in this case, the discharges are profuse, which means there's a lot of it. They're thick. They're not ropey, though, like something like Cali Bic, which is like you pull it out of the nose and it's like, oozing cheese. It's more thick, as in when they expectorate or when they're looking at a wound, it's going to look thick, not viscous, thin or viscous. Bland. Now, when I talk about bland here, I talk about it not being excoriating. So it's not a burning, excoriating thing, say like apis, which we've talked about, which can have that burning discharge. This is a bland discharge, so it's not going to burn the skin. It's not going to cause those red nasal. It's not going to cause red lips. It's just this bland discharge that is, and this one is key: yellow, green, yellow, and then yellow, green. All right. Another one of the yellow discharges, though, is sulfur, so don't rule that out either. Pains, they're going to describe them as burning, but so too is cantharis. So too is apis. Again, differentially diagnosed. Stitching with numbness. So it's this, stitching pain, and then it goes numb. And it might scrape, it might jerk, it's like, again, you need to differentiate with potentially hyperic because it could be nerve innervative. When you get that electric lightning bolt type strike is generally a nerve pain. So you need to look at that scraping, jerking, tearing. One big thing about this is it will wander. So they may have a headache that starts here, that moves there, that goes up there, that comes down here, that goes across there, that might end up here. They wander. Their pains will wander. And they will describe their pain as if they've got a bandage wrapped on them, or that they're wearing they've got a tight band around their head for their headache, or that it feels like they've got a wrapping over them. Okay. They, when sleeping, like to uncover their feet, but so too does sulfur. All right. It's another one of those. So these are all the sorts of things that you then differentially diagnose. This is how you choose your remedies. They sleep on their back and they sleep with their head propped up. They hate having one pillow, the Pulsatillas. They have to have two, sometimes three. They might even have 8 pillows on their bed. They're those sorts of people. And they sleep with their hands behind their back. They sleep like this, with their hands behind their head, on their back. La-li-la-li-la, that's how they sleep, okay? The child seriously desires to be carried, but it has to be carried slowly. Do not rush with these children. They will get agitated. They will get aggravated. And again, it's a right-sided remedy, but it's often right-sided. Again, shifting, changing. Whenever you think pulsatilla, it's no two symptoms are the same. It shifts, it changes. Okay, so it might be right and then it goes left. It might go up and then it goes down. It'll wander. Okay. Here are some of the other generals. And you can see here that we have worse for heat. They hate it. They hate being in one of those stuffy rooms. These are the people that will have a window open. They will need cool. It has to be cool open air, not hot air coming in. Not, not like these westerly winds that we get that are quite hot. It has to be a cool, open air, even if they're feeling chilly. Okay? Windows must be open. And they are worse. And this is a big thing with Pulsatilla. The teenagers, so again, here's this never well since puberty. The teenagers may feel that their menstrual cycle is delayed. These might be the girls that start their menses at 15, 16, as opposed to 12, 13. They're not early starters, they're delayed. Their symptoms are worse before their menstrual cycle. So they're going to be more weepy, they're going to be more teary, they're going to be more moody, they're going to be more pain prior to their menstrual cycle. They're worse in the evening, especially at twilight. So that sort of 5, 6, 7, depends on whether you're in daylight savings. But, at twilight, just as it's coming to dusk, that's when, and think about it. What do we normally do at dusk? This is when we're probably starting to cook our dinner. And these are the women that turn around and their symptoms get worse. Just as the kids are screaming, the husband's home expecting his dinner, and their symptoms might change. Their mood will change. Everything about them may change at twilight. They're no good for fatty foods. So this is pork. This is cream. This is rich foods. Different to nux vomica. They're both a sort of overindulgency type food situation. But nux is more alcohol and caffeine. Whereas Pulsatilla, they're worse for that rich, creamy. They love their pastries. They put it this way, they love it, but they don't do well with it. Okay, so cream, fat, pastries, rich food, big stews. In winter, there's sort of, all those real comforty type foods, pork dishes, that sort of thing. No good, no good. And another thing they don't like is heavy clothes or scratchy clothes, woolen clothes in particular, or, these are the little children that don't do well with flannel sheets or flannel pajamas, yeah? They don't like woolen jumpers. They don't, it's that heavy, scratchy feeling that they don't like. And they are always worse for getting their feet wet. And it doesn't matter whether it's cold water or hot water, they do not like wet feet. Okay, then they're not particularly great swimmers either. All right. Symptoms that make them feel better, as I said before, cool open air, cold applications. These are the little ones that love when mum puts a cold compress on their head and goes, "It's only going to be okay, little one. Don't you worry. You're going to be fine." And, it has to be cool. So they will then, say, "Can I have another cold one, please, Mummy?" They like gentle motions. There's that little flower. Gentle, gentle. And they like sitting in an erect position. So they would prefer to be sitting up than lying down sometimes. And they're the ones these are the little ones that love their back, or their forehead stroked, where mum goes, "It's going to be okay, little one. I love you. You're going to be okay." Cold applications, gentle motions, massages. We're not talking, proper therapeutic massage. We're talking effleurage, for those of you that know that word. Gentle little round circular strokes. They absolutely desire consolation. So this is, "Give me a hug. I love you. Give me a hug." Consolation, love, attention, company, sympathy. Another thing, though, that they do love so much, especially when they're unwell, is sour, refreshing things like lemonade. Now, that is also a good one for belladonna. So there's another differential diagnostics between Pulsatilla and belladonna. They also love lemons and lemonades, okay? And they have a huge aversion, which I've already talked to you about, of being alone. They do not wish to be alone. These are the ones that, are literally clinging to mum in the supermarket. They have to have mum within in visual distance. They have to be able to see their mama. Have to. Physical symptoms. So some of the things that you could consider prescribing for are muscle spasms. Different, say, to a sprain and a strain where there might be pain. These are spasms. These are like dysmenorrhea, where there's that spasmodic cramping, but again, differentially diagnosed with magnesium phosphate, which is also a cramping remedy, or even bryonia, worse for movement, where they've got those muscle spasms. This is a great one for conjunctivitis. Thick, profuse yellow. There's that thick, profuse yellow, not excoriating, bland. So they've got yellow discharge coming out of their eyes, okay, and their eyes are going to be red. They could be quite watery, but it doesn't hurt them. It's just icky looking, okay. Pressure and soreness felt in chest. They will often, when they've got respiratory issues, will feel sore in the chest, and pressure is something that they will experience. Again, with their menses, tend to be late and scanty. Now, scanty means that it's not a very strong, good flow. You know, it's not normal. It is scanty. It is a light flow. So these are the women that might say that, you know, my period tends to be late and my menstrual bleed tends to be light. So I'll bleed for maybe one day, or the first 2 days might be light, and then I'll bleed for one day and then they're light again. Okay. But the blood that they experienced is not that bright red, frank blood. It is dark, thick blood. All right. Dark, thick blood, which is also, I think you'll find, a phytolacca aspect as well, which is dark and thick, as opposed to belladonna, which is bright red. Okay. They tend to have one-sided headaches. You know, it could be left, could be right, could be any, but it could swap sides. And it's generally from being overworked, where or potentially where they've suppressed their sexual desire. So again, in this situation, puberty, you know, when hormones are rampant and boys and girls or young women, young men are starting to experiment sexually, they may be suppressing that real sexual desire to want to, for a better word, jump bones, you know, or have intercourse. All right. And because of them suppressing that sexual desire, they get these one-sided headaches. They have a tendency that they may get indigestion, which will also give these one-sided headaches. And here is this ice cream with lacrimation. Now, lacrimation means weepiness, weepy eyes. So they could be eating their ice cream and there could be tears. And they don't know why there's tears, but there could be tears. Yeah? I'm alone. Give me more ice cream. Think about it also. Phosphorus, though, likes their ice cream too. Phosphorus likes ice and ice cream. All these differential diagnostics, important in homeopathy. They can suffer from panic attacks. There is that heart palpitation. And it, you know, be careful though when you're taking their symptoms, that you're trying to rule out that it's not a cardiac arrest, obviously, but heart palpitations. You know, they're worse for their left side, especially when they're anxious. So that's that anxious, panicky, you know, panic attack type aspect, which, you know, in an acute situation, you could give them Pulsatilla, and I would be looking at maybe, you know, even 200C, you know, but 30C will help every 15 minutes or so until the symptoms subside. There is involuntary urination here, especially at night, and this could be bedwetting for the children. You know, again, here's that, I'm afraid of the dark and there's ghosts, so I'm going to wet the bed. You know, They wake up and they're crying and they want their mum, and then mum takes them to bed, and then mum starts, mum and dad have a fight because Bubba's always in bed, and on it goes. Um, this is also for urinary incontinence, and here's this never well since pregnancy. Urinary incontinence or involuntary urination when they cough or they sneeze, or even if they have flatulence and fart, especially post pregnancy. Yeah, once they've delivered Bubba. Pain in the limbs that suddenly ceases. So what happens is, unlike say aconite or belladonna, which is sudden, it's in there and you know that it's happening. Pulsatilla can be quite a gradual lead up to the symptoms. Yeah, quite gradual. But then their symptoms will suddenly cease. So it's worse for letting the affected limb hang. So what happens is, when you're sitting and sometimes your legs are rocking and they're just hanging, and that's when the symptoms can get worse. All right. But the symptoms will cease very rapidly. Very rapidly, they will tell you. Can be gradual. They can be sudden, but it's not traditional. But they're very rapid in their cessation. They have shortness of breath. They can get shortness of breath. So you could think of this for an acute asthma situation, and they're worse for lying on their left side. They feel smothered. And it's a different type of constrictive smothered that the snake remedies might have. This is I can't, I can't, I can't breathe, and then panic sets in, and then they get the heart palpitations, and so especially when they're lying on their left side, and that's where the heart is. Yeah. There's this dry mouth. Now, their dry mouth does not incur thirst. They are very non-thirsty. They are thirstless. That is one of the key symptoms to pulsatilla. And if everybody should be, when they're doing their consultations, looking at people's tongues, looking at people's nails. They have a yellow to white tongue covered in mucus. So you could think of this for oral candida potentially. Yeah. But one of the biggest things that they will have is just in the middle of their lip here, there will be a little crack. And you've all seen it. Now you can all relate it to a remedy. In this case, pulsatilla. But it might not be the only remedy, so make sure you differentially diagnose. Moving on. So indications here, as I said, conjunctivitis, styes, angulation. Now, what that means is those people that wake up where their eyes are closed and they go to open them and it's really sticky. Whether you've felt that or not, I'm sure you've heard people talk about it. So they open their eyes and there's this goop. Even if it's little bubbers or children or adults, and it doesn't necessarily have to be linked to an infection or styes or anything like that. It might even just be sleep, when they're sleeping, they wake up with that. So think pulsatilla. Digestively, again, here we have heartburn, toothaches, candida, we talked about that, oral, hemorrhoids, but other hemorrhoids, and remember with hemorrhoids, there might be an itchy anus. So hemorrhoids, it could be sulfur as well. Anemia, again, you could look at the ferrum phos for that too. But here's a big one, and this tells you when they've got an infection as well. As we all working out with our anatomy and physiology and our diseases, there's a loss of smell and taste. And what was the very first things that they all said about the pandemic? Loss of smell and taste. We could have been giving them pulsatilla, but the main remedy during that was arsenicum album. Reproductively, PMS. This is a very, very good one for just prior to birth or just prior to labour, where Bubba's head is not in the right position. Bubba has not turned. So if your patient rings you and she says, they've told me that Bubba's still not turning, think pulsatilla. And I would be looking at maybe a 30C to 100C, hourly to help with Bubba's turning. Good one, great one for uterine prolapse. But another one for that would be potentially lachesis, because that's a never well since menopause, and uterine prolapses generally happen postmenopausally, generally. Not always, but generally. A great one for breastfeeding, lactation, but so too is phytolacca. So don't forget that as well. And we've got here amenorrhea. So this is absence. Anything with an A in front of it means absence for those of you that have yet to do your disease states. I said before dysmenorrhea, anything with dys in front of it means uncomfortable or painful. It may help to improve sleep. And it's a good one for, again, here's this never well since puberty. A great one for, especially in girls where they've got acne. So prior to them going to the doctor and being put on an OCP, because that's what doctors do. And we've got young girls girls as young as 10, 11, 12, 13 that are now starting to get their menses, and the first thing that they get put on is an oral contraceptive, when they should be having homeopathics, basically. And in this case, it could be Pulsatilla, all right, for that acne during puberty. There is earaches, worse at night. And here's this swimmer's ears. So they may not want to get their feet wet. They may not want to go swimming purely because they always get swimmer's ears. So instead of putting that icky stuff that you get from the chemist, give them a dose of Pulsatilla. You could even put a little dose of Pulsatilla in their ear. Yeah, but make sure they lie on the side that they're feeling that swimmer's ear. Great one for joint pain, but so too are all your muscly type remedies like bryonia and Rudigrave. Rudigrave is a really big one for bone pain in particular. Rustox, great one for potentially gout, but not always. This is a fabulous one for varicose veins. There is chicken pox here. So think childhood diseases when you think Pulsatilla as well. So this is your chicken pox, your measles, your mumps. Again, it's a total symptom picture though. It's not an actual. And it's a great one that has many, 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 many fears. Okay. Keynotes, changeable, shifting symptoms. We've discussed that. I don't think I need to discuss that anymore. Changing moods. No two stools the same. Changing in fever. 1 minute they'll have a fever, then it'll drop, then it'll come back. Changing in pains. Pains will wander. Change in bleeds. Yeah. Change to their face. It may go pale, it may go red, it may get hot, it may sweat, it may not. Again, they weep, especially when telling their story. Their symptoms will rise in intensity and then stop. And they are thirstless. So all things, it is a bit of a repetition, but these are all mitigating keynote symptoms. And here's a case. An 18-year-old female, she had a very good constitution. There was no hereditary predisposition, so the medical history of her family, there was nothing in particular that stood out. She had amenorrhea, so no periods for 6 months. She used to have a small seizure instead of the period. So instead of bleeding, she would have a little fit or a little seizure. She was quite a sad patient, very pale patient. This particular practitioner, by Janice, gave her Pulsatilla 1 dose a day for a short period of time. It didn't say how long, so I'm sorry that I can't give you that. But the menses did actually return the following month with no more seizures. So she started to bleed that next month. So see here, and it's only a low potency because it's very physical. Even though she's sad, the amenorrhea is very physical. In comparison with other remedies, you've got allium sepia, also does not like that stuffy room, loves open air, but the difference here is that their discharge is thin, not thick, and excoriating, so burning, not bland. Carbo veg also does not like fatty foods or ice creams. Urtica urine, delayed lactation. So again, with lactation, there are several remedies to give during lactation. You just need to differentially diagnose. Now, here is a very big one because chamomilla and pulsatilla and belladonna are your main children's remedies. Now, in this case, though, chamomilla will antidote pulsatilla and vice versa. So what does that mean? If you give them chamomilla or if you give them pulsatilla, you will find that they may have an aggravation. If their aggravation is so severe, you've given them pulsatilla, say, you can then give them chamomilla, right, which will antidote the pulsatilla, and then you can move forward by giving them doses of chamomilla. So one will neutralise the other, as it says in the notes, before you can then proceed with treating, and it's generally using that next remedy. So you've given them chamomilla, they've had an aggravation, you give them pulsatilla as an antidote, you then continue with pulsatilla. You give them pulsatilla, they have an aggravation, you give them chamomilla to antidote, and then you continue with chamomilla. I hope that makes sense. And here is another one for swimmer's ear, and that is silica. All right. Now that gives you a great overview. Love pulsatilla. Use it often. Children, women, and you can see there also men. So yeah, pulsatilla all the way. Here's your little mnemonic. Pale, plump, that should say, pensive, soft, fair, emotional. Urinary issues. So there's that incontinence, especially in girls. There's that lack of thirst, even though they've got that dry mouth. Shifting symptoms. They change all the time. Change. Adverse to fatty foods, tear up easily, better for open air, worse for stuffy rooms. You can read the rest, late menses, scanty menses, hormonal disorders. The only thing that I will sort of query is that left-sided complaints. As I said, they generally start right, not left, but they can move to left. And you can see here everything that we've just discussed pretty much. Learn more with Switch on Health. I'm Sal, and I'll see you in the next one. Ciao for now.